It's 9 a.m. this morning, Thursday, January 4th. This is the Personnel and Finance Committee meeting. I'll start with item 2, public comments. Do we have any public comments in the room? Any public comments on Zoom? Any public comments at all? No. We'll close the public comments. Don?
I move to adopt today's agenda minus the January 4th, 2024 on item 10.
Okay. Then move to approve. Everybody? Okay. Okay, approval of minutes, Dave.
Second.
Approved and seconded minutes, December 7th. Vote.
Aye.
Aye. 5-0. Item 5. Paul?
Okay, let me know if I'm not speaking loud enough through the math. First thing I'm gonna just go through quickly is investments. The portfolio is at 171 million, was 36 of that in money market. I did invest $6 million on December 26th into US Treasuries, so US Treasuries are up to $10 million. The rates have gone down basically almost 100 basis points, so I wanted to get some money in before they went down, because I figured at the beginning of the year, with the Fed not hiking the rates anymore, rates are gonna start plummeting. So I'm probably pretty much into where I want to be for long-term investments. We've got about 24 to 25 million going out for the next 4 or 5 years, and about 15 to 20 million the 3 years after that. So I feel good about that, but I don't feel good about doing any more, because it seems like we're pushing through more projects. And I kind of want to see where our fund balances are before I start spending any more cash as far as that goes. So, that's where we're at with investments right now.
Yeah, it seems now they're talking that the rate cuts might not exist, and they might be going back out.
I know.
I mean, I was
So it's-
watching the market again yesterday, and that's pretty much taken off the table, and it affected the stock market the last couple of days, so.
Right, but I have a feeling the whole Red Sea thing is gonna kind of dictate they better not raise them, because supply issues are becoming an issue again with that. Not as bad as what it was before, but it's still gonna affect it when you're adding 2 to 4 weeks having to drive around Africa. So yeah, so I have a feeling they're gonna be really, really cognizant of not increasing. And if things start going down, they might actually decrease. It's still the thought pattern for long term for this year. I mean, this 1 year is long term for the Fed.
Election year.
So, fund policy. I promised Chairman Cox that I would have something for this meeting. So I put something together. As I indicated, this is kind of board discussion. I should have had draft on it. I forgot to put the draft in the background. So, I still have to go through this with, the admin and executive department. So, I wanted to go through it with you guys too. And kind of explain my rationale with, and I don't know how familiar you all are with funds, government accounting and so forth, but in the last couple of months, I think I've learned more about fund accounting than I want to, but I need to know more. So that's my job. So that's what I'm trying to work on. I know there's a lot of talk about restricted, unrestricted, all the different wording. Basically, the term they're using now for the GFOA and GASB is unassigned general fund. Is basically the money that is your piggy bank, for a better word. Then I found out that there's basically what they call, that is number 5 on the first page, is unassigned general fund. Then there's what they call the assigned fund. The assigned fund is just taking part of the unassigned general fund and saying, we're gonna kind of use it for that. It doesn't take a basically board vote, doesn't take committee approval. It's kind of like we designate these funds for this purpose. And that's what we want to use them for. But if they're not used or the purpose is completed, they can then be brought back into unassigned general fund. Then you get into committed funds, which them are basically board approval, and they are committed for that purpose, and that is all they can be used for until the board either changes that verbiage or that ruling, or the project is complete, but it still takes board approval to bring the funds back into the unassigned general fund. Restricted funds are basically that. They are special purpose stipulated for external resources by legislation. So that's, that's state legislation and so forth. Non-spendable funds basically deal into inventory, prepaid items, and delinquent taxes. If you look over on this first big page, it kind of shows you the general fund unassigned in the first column. That is basically what I'm talking about for number 5. Let's see if I have that in here. Yeah, on page 3. Okay, 1 second. Page 3 basically is showing the other ones listed up top, some of them are listed, and they show like the jail improvement fund, that is a committed fund. That is basically the funds are being paid for different sources or fees or fines and so forth. So that is committed for jail improvement, period. Can't be used for anything else. The public health is an assigned fund. The property lister assigned fund, scholarship funds committed. We got the boat launch, which would be assigned, technology fund is assigned, and land records assigned, and then IDP, which is on a different page, that is a committed one because that was based on board approval to create that industrial board development board fund. So that this is kind of showing you what I was trying to point out is it's more inclusive than just talking about the unassigned general fund. When we start talking about funds in the county and we just only focus on the unassigned general fund, I think we're taking a narrow view of the piggy bank. That piggy bank could have been taken out and used for different areas for assigning. And I'm not gonna say why it was done or what was done, but there are definite reasons, and I talked to Kerber Rose, the partner there, David Mensch, on some of this and what governments do and why they do it. It's kind of like having funds to support other areas like public health, DHS, so forth and so on. So they have that as an assignment. It doesn't necessarily mean it needs to stay in that assignment. It can become part of the unassigned general fund. I want to have a global looking at the funds. Where are we as a whole for the county? Not just a little narrow definition of the unassigned general fund, because that fluctuates. I mean, the county, from what I looked at, was up and around $67 million at one point, and the county started spending lots of money. Which was, you shouldn't hold it in your piggy bank if you can improve things and make things better. So that has drastically been reduced. Which is a good thing that we had the money, the county had the money to spend to take care of certain projects. We're getting to the point where I think it's a good time to look at the fund policy. and see where we're at. But I didn't wanna just look at one little narrow part of it. I wanted to bring together a policy to look at all the different areas of the funds. So that's what I tried to do with this policy. And the first 2 pages are basically just the purpose of it and the definitions. And the definitions basically come from GASB and come from the GFOA best practices. So that is basically from them. And as I showed, there's the general fund, which is part of, I mean, this list is basically the general fund. So it's unassigned, assigned, and committed. There's all of that inside of the general fund. The unassigned general fund is a portion of that general fund. If that makes sense. So I talked about the unassigned general fund. There is the other one. There is the proprietary funds for Winnebago County. There's 4 proprietary funds for Winnebago County: solid waste, Parkview. Okay, I'm gonna move them.
Highway there, kind of.
Highway and airport. Okay, so there's 4 of them. Basically, what it says is proprietary fund, otherwise referred to as enterprise, are used to report activities that fees are charged to external users for goods and services. The principal source of revenue for these funds are from sources other than property taxes, grants, and transfers. The county reports the following as enterprise fund. So basically, these are, for a better word, supposed to be self-sustaining. But we know for Winnebago County, right now, technically, there's really only one that is self-sustaining, and that's solid waste. Airport, highway, and Parkview is not self-sustaining at this point. My discussions with Kerber Rose, when I discussed him, he said that he doesn't know of a medical or a facility for taking care of people in the county, for any county that is really self-sustaining. But it is a choice of the county that they want that and they're willing to fund that. It's a question of what are we funding? How much are we funding? Are we at least holding our own and not constantly funding more? So that is something where part of this is I also want to look at the proprietary funds along with the general fund. And then the last one is the internal service fund. The internal service funds basically are funds that, for a better word, we're charging out expenses to departments. So technically, I know I've gotten into discussion with admin a few times on, technically, these funds are not getting any tax levy. But we're charging the departments that the departments potentially are getting tax levy. So in order to pay for these services, departments are paying for the services, but departments get tax levy. So kind of in a roundabout catch-22 circle, it's really kind of partially coming from tax levy.
Well, excuse me, but aren't these, each one of these departments their own cost center? And
Which
aren't they-
department?
Pardon me?
Which department?
Well, general services, workers' compensation,
They are their own
Property.
fund.
they have their own cost center.
They have their own fund.
Yeah.
Basically, fund accounting is its own little, for a better word, entity by itself.
Right,
So each fund is kind of like its own little business, for a better word. So they are kind of like, that's the purpose of the fund, is to make sure you're managing that activity correctly. So yes, each of these, not necessarily have their own departments, but they have their own fund. So they probably technically, for general ledger, have their own department too, and own division and so
Yeah.
forth. But they have their own fund, which usually it's department, division, fund. So it's kind of that hierarchy. So the fund is the big main one.
Are we asking questions now?
we'll get into that, I think, once
That's
it
fine.
finishes his presentation.
We're not allowed to ask questions. Okay, but you are. Go ahead, sorry.
Okay, so, there are other funds that, I'm not gonna discuss too much because them are kind of dictated with the debt service fund, the capital projects fund. And there also is the human services fund. which is Fund 200. That kind of, it manages human services together. So they're kind of inclusive of that. Human services, whatever, for the most part, is left over in their end of year, either excess, if it's excess, which it has been the last several years, that comes back in the unassigned general fund. So the policy, I kind of went through some of this stuff. Basically, I'm looking at a goal for the, to have the, as I try to discuss, the unassigned fund and the assigned fund is the general fund. The committed, we can't really use for our discretion. So my goal, I'm gonna look at the 20 to 25% of expenses for general fund, to make sure that we have that much balance in there at the time we, point in time we analyze it. And I'm gonna look at that when we do budgets to see where we're at the budget time. And also look at it when we're done with the audit to find out where the actuals line up. Because right now, without knowing what the actuals are, this is basically all this information on these pages is budget. It's actuals up through 2022, and then what budget amounts are were to give you the balances. So if you go back to this page here, this page basically shows that we had $51 million at the beginning of 2022. And we're looking to have 17 in unassigned general fund. So basically what we're doing is the general fund, the unassigned is coming down. So where we're at, I still think we're within that 20 to 25% when we look at the whole picture. But I don't, like I said, I don't have all that information, so I want to have that information to present in a better format or detail to you of where we're truly at, or my best guess at where we're at. And I don't have that right now because we're still looking at actuals. All I have is budget numbers, and actuals are probably not going to be for another couple months. Because we're still waiting for revenue to come in. Revenue we have until the end of February before all of that has to get booked. So we will have a better picture at that point in time of where our fund balance is. What else do I need to cover here? I also want to look at, like I said, this second long page here. It shows our general fund, which is the total of this page. So it's the final column is brought over into the first column here on the second page. And then it kind of lists across all the different funds that we have. IDB, DHS, airport, landfill, Parkview, highway, general services, workers' comp, so forth and so on. Granted, some of these are our proprietary funds, so we're not looking at them as far as for where we're at with them. We need to look at them to see where we're at. And how much we're using in tax levy. So going forward, that's going to be another potential calculation, or at least a range of how much are we contributing to fund these activities of tax levy versus what should be in their fund. I haven't had a chance, as I said, to talk to the executive or admin on, do we want to move money into the fund to cover that? Or do we want to subsidize the fund with tax levy and keep it separate? Or do we increase the fund balance? It's basically accounting and semantics of how we want to show that on the financial statement. So I think it's more important of what we're really doing and how we're doing it and what we're looking at. So I just wanted to show this to say that we started at 21 million for the general fund of 56 is, I think, around 35%, where we were at like 51% at the beginning of 2022. So we definitely have brought down that balance. Is it where we want it to be yet? I don't know. I'm still analyzing that and reviewing that, but I wanted to get this before you because I promised Chairman Cox I would have something to review. That's I think pretty much all I have, because that, any questions?
So I have a question about your proprietary funds. So this is different from, because I know I'm on the airport committee, so I know that we have a separate fund of monies that we receive from Oshkosh Court to store their trucks. That's not a fund. This is a completely different fund, correct? This is not that, because we're trying to deplete that one, I think,
Well,
was kind of
this-
what we were told.
They have an airport fund.
Like, so that runs the entire airport is what you're saying,
There's-
not the separate funds that, you know,
There is a contingency fund, that's it.
Oh,
no, that's not what I'm asking.
I'm not positive about the.
I think
do you
Jim
know
will
about
understand it
that?
a little bit more because he's here, but it's the separate fund that we receive money from. So that's not what we're talking about here, right? That's like a complete separate thing.
Well, we have our own undesignated fund balance, where the airport has enterprise fund.
Okay.
That is what this is.
Oh, that is what that is.
$941,000 is their unassigned fund balance as of the end of 2022.
Oh, I was meaning, but that's not the definition of proprietary fund. That's a whole nother thing, right? I'm just trying to keep it straight in my head when I'm just looking at these
The
definitions.
proprietary fund is,
It's
that's
running the
that's
entire
the
airport.
definition for GFOA, which is they're a self-sustaining fund, which if they're self-sustaining, this 941 would be like their retained earnings.
Okay,
So they would have revenue, they would have expenses, and then that fund would go up and down, but with them being self-sustaining, it would never hit zero. But right now, or it has been hitting zero because they've been getting tax levy of, I don't know if it's been $1 million, but I don't have them numbers all memorized. But they've been getting tax levy, so question is, do you bring that down to zero and show that we're using $2 million for tax levy?
mhm.
So that the board sees 2 million of tax levy is being used at the airport? Or do we continue using 1 million for tax levy and 200,000 of airport funds we're using from two sources, which for some people can be unclear of how much money is really
Actually,
subsidizing the airport.
Got it.
That is their fund balance as of right now, which is, for a better word, their retained earnings.
Thank you. I understand it a lot more clear. Thank you for that.
The 20 to 25% target, is that for the general fund or the unassigned general fund?
That's for the defined as the unassigned and assigned general fund. So that's for the two of them combined.
And that's the way it's always been?
No, it has been 16 to 20% of unassigned fund.
No, I mean, the two combined. It's,
Well, the
Our
target,
The current
current
policy,
policy is based on only unassigned. So this is requiring, this draft
Adding
would
in-
require a bigger percentage of a bigger number, you know, so we're looking at a wider definition of the fund
Right.
we're looking at. It's kind of the numerator in that percentage.
yeah, and I have an ask when we get these reports. I mean, I can go along with that. I'm good with that. But when we get these reports, could we get what the target is and what we're actually at our, like, we'll say at 21%? Right. When we get these reports, can we get that information?
sure, yep.
And I got one more ask, when this comes forward, can all the changes be highlighted?
Sure, I don't think there'll be many, but that depends on.
Well, that's gonna be a
Admin executive, but yeah,
pretty big one.
yeah.
Don, you're interested in the analysis of the general fund policy when we get ready to do a look at the unrestricted general fund and the items that we add up in order to do the bonding issue. That
It sounds like that's what you're going after, correct?
our bonding issue comes from basically the unrestricted general fund compared to what we have.
We don't use unrestricted, it's not a word. Unassigned or assigned, unrestricted is kind of a made up.
Well, the unassigned
Right.
fund balance. Okay, when we're taking a look at the budgeted expenditures of governmental funds. And so that we have reached a certain percentage, which was 16 to 20% on the target range.
Right, we were way above the 16 to 20%. We were more into the 30 to 35% at one point in time. And that has been pointed out that it's better to have a higher percentage as you go and look for bonding. And as long as you have that percentage and you hit that percentage, your bond rating will be higher. I'm not sure ours will ever get up to AAA, but it'll stay at the AA for sure. But we have not been getting credit, or Winnebago County has not been getting credit for having that much unassigned general fund.
Right.
We have said 16 to 20, even though we had 30 to 35. So that wasn't really being taken into account when they were reviewing our bonding. It didn't matter. We still got a good rate. We still had a AA. So I mean, it didn't affect it, but just as to make sure we have it, just in case it goes lower, we're hitting what we said we're hitting.
So looking at the 20 to 25%, I'm gonna kind of go off a little bit what he was saying, so. And so in the past, we've only looked at the general fund and assigned, right? So the 51,528,000, what have you, on the first column,
Right.
the audited balance, so, but because of the way that it's going to be reported now, if I'm not mistaken, I'm just gonna make this a little bit more layman's here. The rest of those funds are now underneath it, and that is the 56 million? No, that would be more, so.
Well, it's 56, but then you have the jail improvement is committed,
Yeah,
scholarship is committed. So there's a couple, the ones that are committed or not. So I just put this together as reference. That's why I said I wasn't ready to vote. I will have the percentages on there. Where we are, where we should be. But like I said, this is kind of just to give you a feel of all the funds we have, where we're at, and try to look at what is the rationale and what is the best,
but you
Yeah.
can't give us a
what is the
percentage.
best benchmarking tool for us? And I'm
Right.
thinking, based on reading this, talking with Kerber Rose, with GFOA, they kind of like what I'm looking at because it's kind of gets more back into better word layman's terms than financial accounting terms.
I like,
So that's what I'm trying to do is get this back to be more not financial governmental. I mean, they basically, their practice is to do a net positions and statement of activities analysis. I don't want to get into that with a group of people or the board. So,
don't do
as
that.
far as I'm concerned, them two things get you the same answer as this does, but this is basically understandable and can be replicated.
It explains the buckets a little bit better, and then with but, you know, we talk about our budget, but our budget's ever changing, right? Because of taxes and what we bring in and so forth, correct? That's how that works, so, I mean, we have an estimate, but like you said,
Doesn't, I mean, like Mike said in a different meeting, the amount of tax levy does not, what we can charge does not go up.
well, we can charge, but what we actually collect could be,
Right.
yeah.
You generally collect most of it because, you know, we get foreclose of the property and then eventually pay it.
Sure.
Just a delay. That's all that.
Yes, Don.
At what time of the year does the excess money go into here?
When we're
The
done,
unassigned,
basically when we know what the numbers are, which is the end of audit to my dismay. was not until July 31st. So I'm used to a end of year audit done by end of March, April. But, with the state and the feds, they sometimes take a while to submit revenue. So that is what I'm hoping that based on my discussions with Carol yesterday, the majority of the funds, the only problem we had last year was with emergency management was waiting on some revenue to come in, so we didn't really have final numbers. But she believes for the most part, end of March, we should be able to have a very good estimate. It won't be done, it won't be audited, it won't be finalized till end of July. But we should have a very good estimate to see where we're at by the end of February. We'll be fine again.
So if you two are good with this and John's good with this, I'm good with it. It's just as long as we
Right.
document the changes
Yeah.
and add the percentages.
Any other questions? Paul, thank you. Mr. Karen. We're on item 6 now. It's pulled up on the approval of the policy. Doug, good morning. Good morning.
Item 6 is a redo of a resolution to accept a grant from the state Department of Health Services for the purpose of installation of 2 public health vending machines. Those vending machines would provide Narcan, fentanyl test strips, Batera bags for disposal of unwanted medications, and potentially other items at their approval of the county executive. The reason this is coming back to you for a second round is that it was pulled from the county board agenda the last time it came through this committee. And so with a couple of modifications that were proposed by the county executive's office to specifically not include some harm reduction materials that are part of our new exchange program. The resolution is coming back to you with essentially similar language. The material that you have in front of you are the materials that would go in the machine. Maddie Brager is here from the health department, and she can walk you through what those items are.
So I'll just show you that this is a Narcan kit, so it has a box of Narcan, a CPR mask. It has our signs and symptoms of an overdose on this sheet, and on the back it has how to administer the Narcan. And then we also include our harm reduction program information, just hours, and what services are there. And then we have our part cards that have the QR code that we can get directly to the app and the phone number to connect with the Solutions Fear Response team. On there, so that's our Narcan kits. And then our fentanyl test strips. So information on the outside has more about our hours of service for the harm reduction program. Again, instructions right on the outside. This QR takes them right to a video that walks them through how to use a fentanyl test strip kit directly. And then again on the outside, because it's kind of opposite what people assume, what is positive and negative results. Inside, this is our instruction sheet that the health department gives out for all our fentanyl test strips. So on the back of it has pictures of what would be a positive, negative, really descriptive, 1 through whatever instructions. Again, the WeHeartU QR code right on there to get them to the app. And then it has the test strips itself, each individual packaged, a microscope. Again, WeHeartU, more program information, and then the sterile water that allows people to use the test kit for one of them. So that's all the supplies that are there. So pretty simple, the 2 kits.
Thanks, Maddie. Also, Maddie handed out just a one-page document for, your review, and information. I think it's just most important to note, and we discussed this last time, but, Narcan is a life-saving measure. Most overdose deaths are accidental. So having, and you cannot administer Narcan to yourself, and so having Narcan available in the community, available in more locations, increases the number of households and individuals that have Narcan present. The vending machines are not an emergency response mechanism. People don't have a crisis and then run to a vending machine to get Narcan. They get Narcan and they keep it in their house, or they keep it, to wherever they go. If they, may be in an environment where someone might overdose. And so having Narcan available in, public facilities, it's already available through, EMS and law enforcement. But increasing the availability of Narcan will help reduce, the number of overdose deaths. Again, most of which I want to emphasize are accidental in nature and mostly caused from fentanyl, which is in unknowing amounts in substances of use. And so it's difficult to know without testing if there's fentanyl present. You still don't know how much fentanyl is present. And we know that a very, very small amount of fentanyl can result in an overdose. And we've seen fentanyl not just in other opioids, but other non-opioid drugs, which makes it particularly dangerous and unsuspecting for someone that's using it. The two vending machines that we're proposing to install here are in addition to at least 60 others that are being placed within the state of Wisconsin. The vending machine and Narcan availability is a recommendation from the state of Wisconsin using opioid funds. And we were able to apply for those funds and get in that first round of funding. So we're just asking for your approval to move forward so this can go to county board.
Any questions?
I guess,
Let's get it on the floor first before
Move for the resolution to authorize acceptance of 80,083 grant from Wisconsin Department of Health Services.
second,
any questions?
would it be possible that they would have cameras to monitor these? So that we could basically see if people were abusing it, and if we did go along with this, to do a 6-month trial period, and see if they are working. I mean, if they're getting abused, I guess I would want to see them stay out there forever. But I'm all on board for putting them out there for 6 months and having you come back at the end of 6 months and giving us a report on how they're actually working. That way we know if we are accomplishing something with them or if they're just being abused. And if they're being abused, I guess then that there's no point in having them, but if they're being used for what their purpose is, providing service for somebody that needs it, and they can't get it at a, odd hour of the night at 2 or 3 o'clock in the morning, I'm all for it. I don't wanna see somebody die because they didn't have opportunity to get something that could help them. And they can get into one of our programs, like we got this over solution now working with the jail, and perhaps we can get that person back on track and his family and they'll live a normal life, But I would like to do it like on a trial basis so that we get a report in 6 months. What your opinion is, are they being abused or are they being used properly? And if you can do that, I would be in support of it.
The machines are connected to the internet. We're able to monitor what's in the machines and what's been taken from the machines. I don't know about cameras.
That wasn't something we intentionally, were going to place or put them in front of. With the contact points of needing to call or visit us to get that access point, that was gonna help us limit it, and do kind of that needs assessment of what that person needed at that time to kind of limit that, somebody being able to overuse the machine. So that was kind of our solution, try to add some of those access points. But the camera specifically, we weren't going.
Yeah, vandalism is certainly a concern. And These are at, the two locations are at public buildings. It's easy for us to monitor those machines daily, to assess the condition of those machines. And we certainly would do that. We can find out from facilities if there's cameras in our building, so the vestibule here, on Otter Avenue. And, around the corner from the employee entrance at the Neenah Human Services Building on the side where the bank is. We can ask facilities if there's any cameras there for, closed hours, monitoring or, surveillance if there is an attempt to vandalize the machines.
I was at the NACO conference and there was two vendors there selling these and there was a lot of interest in them. I think they have a good, if they're used properly, providing they're not abused and, somebody just comes there and thinks it's a joke and takes half the stuff out of it.
Yeah, the way these are set up, you can't do that. I mean, you would have to, I guess you would have to physically break into the machine in order to take more materials than the code would allow.
And something that I've inquired on too, there is extra security measures these are outdoors, you can have them bolt down kits that you can secure into the walls. Salespeople, when I talk to different vendors, just inquire on them, they said they're like 800 pounds. So somebody's not gonna be able to come up and just try to rip this thing. So they will be secure and that's definitely something, putting extra mechanisms on there that somebody can't break it very easily at least, so.
And they actually had two different kinds there. One was just like a cabinet, they opened the door and it was all there. And the other one was a vending machine. But the guy that had the cabinet where you just helped yourself, he said there's honor amongst drug addictions, that they're not gonna take that because they don't wanna see somebody die because they just took it to waste it. So I mean, I would prefer the ones that you have to have code. But he said that the other ones, he had no problem with it and that's what they sell.
Yes,
So that's what they sell, so of course they're gonna make it sound like they have an honor system. I mean, I have a niece who was a drug addict and she did not have an honor system. So I'm not sure where that comes from, but once again, I asked last time for data and there's no data here. I wanna see that this has been someplace other than California or someplace else local that has actually worked. And there's nothing in here that's suggesting that or showing that there has been a decrease. And I think I asked for that last time. Also, this vending machine is gonna be across from the YMCA. And that's where all the kids, they hang out in the front, I mean, this is a location that's around where younger kids are. So I'm not comfortable with that. I'm not comfortable with this whole entire thing just because I've heard from the sheriff, I've heard from the ME, I've heard from everyone, and I will absolutely not vote for this, because I think if anything, I'd rather see this money go towards solutions, or I would see it, I want to see this kind of money go more towards solving the actual root of the problem, not putting a Band-Aid on it. That's what I want, but that's my opinion, and I'm only one on this board, so.
So the funds that are, being provided for this are specific for this purpose. If we don't take advantage of them, they'll just go somewhere else. And, vending machines are, one of many strategies that are being employed to help reduce, overdoses and address substance use altogether. So it's part of a comprehensive, package of interventions that we hope will help reduce deaths in our community.
yes, Don?
You said it will save lives, overdoses, but you don't tell us that it also enable people to feel like drug use is safer. So it'll also create this.
I appreciate that point. I believe it's a bit of a myth that that having Narcan available encourages people to engage in riskier behaviors or attempt to do overdoses and try to get recovered from. There really is no evidence to support that people attempt to overdose because they have Narcan present. Most people die because they're alone and Narcan isn't present.
That wasn't my point. My point was that people feel safer doing drugs. If they
have this false security.
We certainly recommend that if somebody is using a substance, that they don't do it alone. And that if there is a potential for an opioid overdose, that Narcan is present. So we're not encouraging behavior. People are going to, they're not gonna not engage in their behaviors just because, Narcan isn't there. Narcan is there to, reverse an overdose. That may not be successful. It may not be enough. It can, in some cases, be enough. It may also, be enough for, a time frame to help a person survive until EMS arrives. And hopefully, that's the other thing too, is that we want people to call EMS. When there is an overdose and, people die because EMS isn't called.
Excuse me, Doug,
Yes.
when you want to activate or use of this vending machine, whatever, what are the steps that you have to go through in order to get use of the vending machine itself? And can that person or persons be available in a group of people to activate the machine without having to make calls into, the health services?
I'll let Maddie get into the details here. Right now, the plan is that a person would have to make contact with public health, or a partner, such as, Solutions or someone else that we authorize to provide a code. We're actually open to not requiring that if the materials, aren't, including the materials that there's been concerns about, such as the needle exchange program materials. We'd like to make access easier, but this is what we feel at this point in time is, going to be supported by the board. So Maddie, you can go over.
I want to make clear that we have not, we're not deciding based on where these machines are being located. We're deciding on the use of the grant to get the materials to stock these machines. And that is all we're deciding on here. So when we get ready to vote, I'm not thinking about where they're placing the machines. I'm thinking about approving a grant. All right, continue on, please.
Yeah, and just to add on to that, Supervisor Cox, as a part of our application, and part of the reason we were successful with our application is that we did, plan out, suitable locations and had a procedure, identified ahead of time that demonstrated that we would be effectively using these machines. So, that information is available here. You are approving the budget transfer, and we've already outlined for DHS how we would use the funds, which include the machines and material. And so, we would proceed with that plan, which is, we certainly are happy to share even more detail on. I believe some people have already asked for the grant application, and we've provided that to others. But Maddie, in terms of access to the machine.
Yeah, so how we anticipate the process could look as a client, community, whoever wants to utilize the machine can call public health, visit us during our office hours or that partner organization to have that expanded access. So that is one of our principles of right now, we only provide Narcan during our office hours at the Oshkosh location. This would provide availability in the northern part of the region and that 24/7 access piece. That person will be able to call, visit us in person, and we'll be able to do that little needs assessment. So determining, having a conversation with that person, what can we do for them at that time? So whether that's providing them Narcan, fentanyl test strips, whatever that may be. From then we'll be able to provide them with that unique PIN code that will allow that person to access the machine. Determining whether that's both machines, wherever is most convenient for that person, but that will help us eliminate that, determine what supplies they need, but also limit that. So they won't be able to go there and pull out whatever they would like. It would be only a certain number of that supplies at that time before they would need to come back with us and do a check-in. like we mentioned, there's lots of different, models to operate a vending machine. This is the one we felt was, you guys, wholly would support, so.
Any further questions?
I just say, I'll support it. For a 6-month trial, I don't see what we have to lose. I mean, they tried prohibition, and how did that go with the alcohol? We just seen a guy drive down the wrong way and wipe out a whole family, you know? Everything isn't perfect, I understand that. It might not work for everybody, somebody might use a needle to use it to take the heroin, but I can't penalize everybody because somebody might abuse it. So I'm willing to try it for 6 months to see where it goes, and if it doesn't work, it doesn't work. You can take them out and send them to another county, but I see on the flyer, Allegheny County's getting them, Grand Chute's getting them, so there are neighbor counties, they're gonna be trying them, so why are we afraid to try them? I'll give it a shot.
Can I just ask Mary Ann, can we amend this for a 6-month period?
Has this wording already passed Board of Health?
Yes.
So if there will be an amendment, it should be done probably on the floor of the county board.
Of the board?
Because presumably this was brought by Board of Health and they passed it as worded.
I'm fine with that.
You're fine with it the way it's worded?
Well, I can amend it on the county board floor.
Okay,
Let the county board as a whole should be deciding this, not 5 of us. I wanna see it go to the county board, and the county board will all make our presentation and try to see what their feelings is on it. If they wanna accept the grant, I'm in favor of accepting it. But I go with the majority, whatever the county board decides is what it's gonna be.
so we vote on a stamp of approval for the materials and the use of the grant. And from there it goes to the board,
Correct.
okay?
Just to clarify on that, he has already said that when they put this grant through, that they had to have a location written on there also. So you keep saying that it's not the location either, but it is, because it was written on the grant. Am I wrong?
What-
So that
let-
is part of this.
Let me clarify what I said. We are voting on a material list, more or less, and the cost of the materials. The machine, the vendor, or the vending machine has been already decided. Is that correct?
We submitted plans with our application for the locations of the machines.
Right.
We have not selected a vendor, a machine type, and the reason this is coming a second time is to provide a little more detail on what materials are gonna be in the machines.
Right. So, are we ready to vote?
Nay,
I,
Aye. 3-2.
Thank you.
Thank you.
You're welcome to keep these materials or share them with someone, or we can collect them.
she's 4 years sober. And pregnant. 1, 2 years, 4 years.
Thank you. Jim? On item 7. Joe?
Thank you, Chairman Cox, members of the committee. Based on a meeting we had with Paul, as the Director of Finance, Carol Blackmore, and the Wisconsin Bureau of Aeronautics back in early 2023, we identified a few capital projects, most of which are grant funded, that have been essentially completed but not added to our fixed asset inventory, for one reason or another. Primarily, the Bureau of Aeronautics takes quite a bit to close out their grants on these projects. Typically, they're FAA grants that flow through the Bureau of Aeronautics and block grant system. And we are constantly, us and a number of airports in the state are constantly pushing the Bureau to close out the grants quicker. And we haven't had a lot of luck. We've seen a little bit of improvement lately, but long story short, there's essentially 4 projects, which would be Taxiway Bravo reconstruction, which took place in 2016 and 2017, stretched a little bit into 2018. When that was complete, Taxiway Alpha reconstruction, which was a 2020 project. Business Park Taxiway also 2020, and then the airport terminal project, which wrapped up in 2021 primarily. And sometimes these projects, the invoices from the Bureau come months later. There's always a punch list for every project, and so things trickle in later than, you know, where we would consider substantial completion on each. Through that meeting that we had with the Bureau and Finance, it was decided that these projects, which all of those total an asset value of about $27 million, which should be put into fixed assets and begin depreciation because they hadn't been, I don't think they'd started depreciation yet. And so that decision was certainly agreed upon. This budget amendment is just because we made that decision mid-year of 2023 to include those projects as fixed assets and start depreciating them. When the budget was done for fiscal year 2023 was obviously back in 22. That said, in order to add the additional depreciation expense, which is a non-cash expense, in 23, the amendment is being brought to you for approval in the amount of $1,409,050 in additional depreciation expense for these capital projects. I also point out that the Bravo project and the Alpha project were 95% state and federal grant funded, and the terminal project was about 36% grant funded, 64% county funded. So there's a variety of funding sources for all these projects, but the assets, and Paul can correct me where I'm wrong, but the assets themselves are ours, it's the airport. So regardless of, because I know that question's been asked before, regardless of the grant funding source, we want to maintain the asset, and we have a lot of requirements to maintain it and grant assurances from the FAA and the state that are associated with those grants, but again, the asset is ours. So that's, I think, hopefully, or do you got something else to add? But that's pretty much the budget amendment.
Anything else?
Move to approve the budget amendment to add 1.409050 in the capital asset depreciation expense.
Second.
Thank you, Don. Questions on the floor? Don?
So something fell through the cracks, correct?
I wouldn't say anything fell through the cracks. It was simply, I would say, the finance director prior to Paul would look at it possibly differently than Paul may look at it. I think we all agree that these projects have been done for a number of years. So we should start depreciating them, and we should start, you know, considering them fixed assets. It's really a nuance primarily driven by the fact that a lot of these grants are still not closed out. So we could have additional expense come, you know, even years later. There have been times when, you know, things trickle through and the Bureau of Aeronautics does things with their financials to kind of close out the project with the grant and the FAA. And that process takes far longer than we'd hoped.
So we're probably,
but I wouldn't say anything fell through the cracks. I would say it's a matter of opinion on when they should be added as fixed assets. Is that accurate?
so this might be coming up in the future also.
I would defer to finance on their opinion of when a capital project should be added as a fixed asset,
Jim?
like going forward.
You have a man over here who wants to get a word in.
Yeah.
Or
My feeling on capital projects, and I've gone through this in my previous career, before the county. Nobody ever seems to want to close a project. They want to leave it open to trickle dollars in. And in Jim's case, that wasn't the case. In Jim's case, it was waiting for invoices from what's called.
We'll be right
So, and the thing is, Carol didn't wanna close things because she didn't know what to do with a $5,000 invoice or a 10 or a $30,000, so forth and so on. I didn't care. I said we'd figure it out. If we gotta put the miscellaneous, we'll put the miscellaneous, we'll do something with it, but $30,000 out of 27 million, I didn't care. I wanted it closed, I wanted it depreciated, I wanted to move forward. So when I came and I saw these projects from 2017 still open, I went, why? Jim was very gracious and got a meeting with the state and so forth. And they did a heck of a job of getting a lot of the stuff taken care of. And they did say we have about 30,000 still open. And I said, okay. And then I talked to Jim and Carol and said, I don't care, let's close them. So that's when we started depreciating. Going forward, I'm kind of looking at the project with Carol and saying what I have done previously is to say, what projects do we think are going to be done and completed? And what is the potential for depreciation expense? You have to remember that really only hits the proprietary funds for the most part, not the general fund, because that's different. As far as depreciation expense goes, so them projects are a little bit better of maybe looking at when we think they're gonna be complete. So hopefully we don't have this going forward. We look at that and review that, but I can't 100% guarantee that.
So we're just cleaning up and hopefully it would.
Well, I have something to add in there, and I kind of talked to Paul yesterday, I believe, regarding it. We set up the levy and the distribution of the depreciated items and whatever in the last budget, and passed it, okay? And then I noticed that we had taken just about the same amount of money and backed it out in order to get the levy the way they wanted it in the last budget. Now, that meant that you were holding back, very likely, depreciating those funds, or you held it back because of the levy that you wanted to set. And now we're going to reevaluate the funds and put another depreciation in the next budget with regard to that line item.
It's certainly, I think it certainly will extend to the life of depreciation of all these assets, just like it does currently, but, it will, like, this is the initial year add for 2023, and then it'll continue on, adding these assets in. Fully depreciate is my understanding.
Mike?
Yeah, I think one way to think of it is, this is a change in our practice. And we're starting to depreciate them earlier because we're closing out projects earlier. So this is really just the catch up. Once we continue to follow this practice, you know, as the projects will be closed earlier, then the depreciation will be included in the budget. You know, which is how it had been. It's just, there's been a large lag sometimes because of the projects closing. So this is really kind of a catch up to account for the change in our practice, which I think is a better practice. The depreciation, of course, isn't a cash expense. No one really cares what our depreciation expense is for the most part. It's an accounting requirement, but you know, not something that's going to.
I'm just concerned that, you know, these will come up, you know, every other month or something.
No, I think in the future it will be included in the budget during the following the normal process, which is not changed.
I'm good with that.
Yeah.
Any other questions? Do we want to vote? Aye. 5-0. Thank you. David, you want to take item 8? Move on.
This will all claim for
Ronald Reckler.
Ronald Reckler. Second.
Any questions on this allowance of the claim? This is a
These-
claim that he had lost his iPhone or his cell phone in the jail. It was logged in. And, they didn't find the phone. And, he had contacted the jail on the matter and they have not found the phone since. And so he's calling claim to it. Now, if we don't disallow it, it won't get to the insurance. So it has to get disallowed before it gets to the insurance, I believe. Isn't that right, Mike?
Not exactly. It goes to the insurance regardless, but the insurance company wants us to disallow claims through county board action, because that will shorten the time limit that claimants have in which to bring a lawsuit against us. So vast majority of these are either denied by the insurance company or settled by the insurance company, which they can do regardless of whether the county board initially denies the claim. But they take care of that and resolve it, and it's very rare for further action to be used.
My question is, there's probably a line somewhere between where it's more cost effective to pay it right off than to send it to insurance. Do we have to send it to insurance?
Oh, we need to notify them right away, so that they can take whatever action they need to take to protect our interest.
Is that our policy that we have to take it to insurance?
It's a requirement of the policy. To have the insurance, we have to agree to provide them with notice of claims.
But they would certainly let us pay $150, right? And not send it to them?
Well, they wouldn't prevent us from paying it if we just chose to pay it, but if it's payable, the insurance company will pay it, so I think it's better to leave it to their expertise.
Yeah, you know, I've never seen them for such a small amount.
We've had numerous ones for small. We have them pretty often for small amounts of money. We had one for
Scratches,
$6 or something a few months ago.
scratches on glass.
Yeah. Condiments taken out of the mate's locker for $3 or something like that.
All right. Any other questions on this? You have a vote?
I,
I,
5-0. We're on to item 9, which is, commendations, and then Betsy's gonna handle it.
I'd like to move to approve accommodations for Thomas Burns, Brian K, Thomas McCurrett. Did I say that correctly? I think Sharon Skeckenberg, Roseanne Smearling, and Randy Wolf. And a memoriam of Patrick O'Brien.
second,
Thanks, Don. We got a vote?
Aye.
Aye, 5-0. Item 10, our next meeting date. It's going to be February 1st, 2024. Yes,
The capital improvement plan projects were presented, as you know, to the county board Tuesday night. So the procedure for approving capital improvement projects requires that presentation before any action. So we didn't have time to get that included on the agenda today, but we would like to have the county board consider that in at the regular January meeting. So I'd like to ask the committee to consider meeting perhaps just before the county board meeting to advance the resolution approving the capital improvement plan projects that were presented.
The 16th?
Yes.
We're gonna approve without any presentation at all.
Well,
We had
I mean, you had
presentations
presentation
Based on,
4 hours.
on Tuesday.
are we going to have a final dollar amount, or is that?
No, we'll distribute the draft resolution, obviously with all of the dollar amounts for each project. It'll just be one resolution, but we did something similar to this last year, just didn't go till February. Right, so we also had that special meeting, I think, last year too,
Yeah,
didn't we?
Yeah,
Because of the timing. So we'll have the one resolution, it'll list all the projects, indicate approval of all the projects, they'll just be the ones that were presented with the same numbers. I don't anticipate that changing at all, unless the county board or this committee wishes to change any of the numbers or take any projects out or anything like that. That's obviously within their purview to do.
We'll end up having to do it as we held the bonding issue, 15 or 20 minutes ahead of the board, if that's what you plan.
Yes, unless the committee would like more time to discuss it or debate anything on it.
I'm good with 5:30 meeting on the 16th.
I may or may not make it in time. Depending on what, sometimes the route takes longer. But, if everybody else is there, you don't need me. Chances are I would make it by 5:30.
Well, let's get assembled and get that room cleaned up at 5:15, for all of us that can make it at 5:15, and those of you that wanna wait until 5:30.
I'll get there as soon as I can.
5:30 is what we're gonna sit down at, okay?
I'll try.
5:30 on the 16th. To include the general business meeting afterward, so.
You wanna make the meeting date for February?
And the meeting date for February 1st is going to be at 9 o'clock in the morning.
And just so you know, I will not be there.
You head to Europe again?
No, Florida. For the entire month.
Really? Goodbye. All right. So, David?
Second.
Everybody. Agreed?
Hi,
I roll on that.
Spring, come back.
I know.
Or maybe winter.